Let's go over sudden illness. Now this has a lot of different categories of illnesses in it. So there's a lot that can fit in there. We've already talked about some of them. Heart attack is classified as a sudden illness. Cardiac arrest, sudden illness. We've already covered those in depth in the first part of the semester, so I'm not going to continue to talk about them. I'm going to go over the ones we really haven't spent a lot of time on. And so since I was just talking about a heart attack, let's talk about brain attacks. So one of the most common misidentified forms of sudden illness is stroke, also called brain attack. So it's an interruption of blood flow to the brain due to either a clot or a rupture. So there's a vessel that has ruptured out, like a hemorrhagic stroke, or you have a clot that goes through and closes off an area so that blood flow can't get to it. So that's the reason this skill is extremely important. And when you look at I want to call it a skill, and really it's also a measure of gathering information. When you look at the steps, it's really to do just that, to gather more information to pass on to 911, because there's very little we can do if something like that's going on internally. The most important step is to recognize what's going on, and that's really why the skill we're going to do that relates to stroke is so important. It's that recognizing or recognition of what's happening. So types of stroke, we have ischemic strokes, and then a smaller classification of that is transient ischemic attacks, TIAs, and then you have hemorrhagic strokes. So an ischemic stroke, it has the highest prevalence. So 85% of the people that have strokes have ischemic strokes. And these are often related to some sort of disease. It can be clots that are building up and preventing, or even blockages in the vessels that are building up, and then a clot comes through and gets stuck. Or it can be a clot coming through and there's a branch in an artery and they get stuck at that branch. They're big enough to make it down the central part, but they're not big enough to make it down the smaller branch. But no matter what, they close off blood flow to the brain so it doesn't get oxygen. And remember, thinking back through all these other modules, the most important organ, the one that we're most concerned about when oxygen gets deprived, is the brain. So we have about 4 to 6 minutes before brain death starts to occur. So this area of the brain that's not getting blood supply could die off if blood flow is not reestablished. Then you have a transient ischemic attack. So if you've ever heard of somebody having a mini stroke, and I know of a couple of people that are younger in age that have had these TIAs, a lot of times it can be caused by supplements that they're taking. It can be caused, probably the most common is family history of TIAs. So you've got to be careful of medications you take, supplements you take. You got to be aware of your family history. All of those can make you more prone to not just TIAs, but ischemic strokes in the future. You may even have a family history of coronary heart disease or having a history of stroke. Both of those are related and could potentially be of concern, especially as you age. So TIAs are short, they're acute, they typically don't stay around long enough to cause permanent damage, but you'll see a lot of the major signs of a stroke. So you'll see paralysis on one side of the body, paralysis on one side of the face, slurred speech, having a really difficult time talking and communicating or even collecting their thoughts. So it'll have all the same symptoms, sometimes not as severe, sometimes as severe as ischemic strokes. But again, they tend to be short-term, acute. The clot busts up, goes about its way, the person recovers. You still want to seek medical attention if you think you're suffering from any type of stroke. Hemorrhagic stroke, smaller percentage of the cases, but greatest risk for death. because you're having an artery that ruptures, and it's not going to heal back on its own. And you can lose a lot amount of blood in a short period of time in the cranial cavity. You're not dying of shock. You're dying of lack of oxygen to that area of the brain. And depending on how large the vessel is, it could be supplying a large percentage of the brain with oxygen. So a lot of people get aneurysms confused with hemorrhagic stroke, and they are related. An aneurysm could be just a ballooning of a vessel that hasn't ruptured. So you have a weakened area in a vessel. Now when it ruptures, that's going to cause a hemorrhagic stroke if that vessel is in the brain. Another major issue with hemorrhagic strokes is as one vessel bursts, it can cause other vessels to burst because you're going to have bleeding in that area that pushes on the brain and can sever other vessels because the blood has nowhere to go because the cranial cavity is not going to be able to expand. That pressure is going to be forced down onto the soft tissue to expand, and that can tear other vessels. And so you get this out of control feedback system where as one vessel ruptures and bleeding occurs in the brain, more bleeding starts to occur, causing even more bleeding to start to occur because the blood has nowhere else to go. So again, remember what I said before. Knowing somebody's having a stroke or being able to identify it is the most important step because there's very little that we can actually do for them. So that's where Think Fast comes from. So it stands for face, arm, speech, and time. And this is how just a layperson like myself can identify somebody's having a stroke. So our first step is to look at their face and have them smile. Say, hey, can you smile for me? And if you see paralysis on one side, that's one indication somebody's having a stroke. Have them lift both arms and try to keep them parallel. So tell them to lift them and keep them parallel. If one arm is drooping or there's loss of motor control on one side, that's another indication. And if it's on the same side as the face, paralysis, then that's even more of a case for, hey, this person may be having a stroke. Have them say something they should know, like their name. Don't ask them the time. I may not know the time right off the top of my head. I may not know the date. Ask them something they should know. So like, hey, what's your name? So if speech may be slurred, they may have an inability to talk or communicate, may make no sense. Another indication that the person may be having a stroke. Now, the T for time stands for two things. It's time to record the time of the event happening, right? So I want to look, okay, this is happening at, let's say, 10:45. So I'll write that down because there are going to be time-sensitive treatments they're going to receive when they get to the hospital. And it's also time to call 911. Now, I have seen in some literature where if you think somebody's having a stroke, you call 911, and then you do these steps. But most literature, most references I've seen now keep it in this order, where you do these steps first and then call 911. Because now you know, right? It's helping you identify if somebody's having a stroke. And you have information you can give to 911. It's going to take you very little time to go through this. So even though there's a small delay in time, what you gain from it is a bigger advantage. So gathering information for EMTs, that's why Think Fast is so important. Don't give the individual any food or drink because they could have throat paralysis, and so we could create another issue if it gets stuck in their throat. And find out if they're taking any medications, because medications can also cause symptoms that are close to a stroke. Plus, they need to know if they are having a stroke and they take them to the hospital if they're on any medications. So you're trying to get information to pass on to EMTs, especially if they're taking some sort of high blood pressure medication. Advanced medical care. Anybody having a stroke needs to seek advanced medical care, even if they have a known condition of having TIAs, something that's short and acute. You never know. It could be an ischemic stroke, could be a hemorrhagic stroke. It could be, normally a TIA that gets worse. It doesn't matter. If you think somebody's having a stroke, they need to seek advanced medical care. It's an emergency situation. There are time-sensitive treatments that they're going to receive to prevent further brain damage. So they may not die from a TIA, but they could potentially suffer some permanent damage, and maybe even damage that they're not aware of. So once they get to the hospital, if they've had an aneurysm that led to a hemorrhagic stroke, they're going to have surgery. They may even have to have a clot removed or busted up. And there are some certain clot busting drugs that they can receive to help them get blood flow established back to the brain. So asthma. This is a common one that most of us will see in our lifetime if we haven't already seen it several times. So a chronic lung disease, restriction of airways, mucus buildup, both can restrict breathing. So the highest prevalence between 5 years of age and 17 years of age. It's not saying that somebody can't have an asthma attack if they're outside that range. This is just where we see the most cases. So signs that somebody's having an asthma attack include coughing, wheezing, shortness of breath. In severe cases, can lead from respiratory distress even to respiratory arrest, where they stop breathing altogether. So care for moderate asthma. So how do we even know if it's moderate asthma? A good common sense way is if they can hold a conversation with you, it's moderate conditions, right? So they're still able to breathe. It's respiratory distress, but not to the point that they can't have a conversation. Put them in a comfortable upright position, so don't have them lay completely back on their back. So maybe even arms up over their head will help open up those lungs, help open up that airway. They should have a rescue inhaler if it's a known condition, and if they do, give them 2 puffs and then wait 15 minutes. And if there's no response after 15 minutes, take 2 more breaths from that rescue inhaler, and then after that second bout of rescue inhaler intervention, if there's no change, we need to contact their physician, even if the symptoms are mild. So something's not happening, something's not working right. That rescue inhaler should help open up that airway. So care for severe asthma. So how do we tell? They can't even have a conversation. They are struggling to breathe. They may even have pale skin. I mean, it can get bad. So place them in a comfortable position, same as before. Give them 2 puffs from that rescue inhaler. Wait 15 minutes. If it still doesn't help, call 911. So keep giving them the medication every 15 minutes until the symptoms either get better or the EMTs arrive, but don't exceed the recommended dosage of that rescue inhaler. Seizure. This is a big one. I see this every semester in class. Just about, almost, or at least somewhere in my building. And it's surprising how many cases there are now. And it's not that they weren't around when I was younger. It's just I wasn't the person in charge, or probably didn't even notice. But at the college level, I'm surprised at how often I see this. So what's happening is there's an electrical disruption in the brain. And some individuals may suffer a single seizure, and others may have repeated seizures. So epilepsy is a chronic condition where people have repeated episodic seizures throughout their lifetime. And then you also have conditions where people will have repeated convulsive and non-convulsive seizures. If they're repeated, we consider it life-threatening. We call 911. A lot of times I'll have students that have seizures, and they'll come up and let me know before the semester starts. And they'll tell me, don't call 911. And I won't, right? If they're like, hey, I have seizures all the time, it gets expensive, ambulance bill, don't call 911. And I tell them, I won't unless you meet certain criteria. If you injure yourself in the process of having the seizure lasts over 2 minutes, because I'm just following guidelines, and I don't want to be held liable for not activating an emergency situation or EMS if there's an emergency situation present. If it happens in or around water, so I don't know if they've aspirated water. So there are certain conditions, right, or if they have repeated seizures where they come around and then have another one. So all layperson skills, so if you look at American Heart, American Red Cross, they all say the same thing, and they all follow those guidelines on when to call. So care, the very first thing I do, and what most literature will recommend, is to clear the area so they don't injure themselves in the process. So you can pad their head, but don't try to hold them down, because then you could cause injuries or further injuries to themselves. Plus, they could injure you. You don't want to try to hold them down on the ground. Once a seizure ends, if they're not fully conscious, or even if they are, put them in a rescue position. That way they have an easy time breathing. And if they have another one, they're already laying down. So don't let them get up and move around. And look for a medical ID bracelet if you don't know if this is a known condition. If you have no idea, don't have any information on the person, look for a medical ID bracelet. It may tell you if they have epilepsy, if this is a known condition. So when to call. If they come back around and they've never experienced a seizure before, you should call 911. There's some sort of underlying problem that's causing this. I actually had this happen to me where I had an individual have a seizure in class, really hit their head hard on the floor, came back around, said they had never had seizures before. So there's two reasons on why I'm going to call 911. I had cleared the class out. I had one person stay so they could write information down as we were getting information from them so we could pass it on to EMTs. I had another individual go wait by the door. But the reason I made everybody else leave is they may have information that you need to pass on to EMTs that they don't want other people to hear, and so they may be unwilling to give that information to you. So if they have repeated seizures, you need to call 911. And if it happens around water, like I said before, or if the seizure lasts more than 2 minutes, that's a reason to call. So now let's move on into diabetic emergencies. So there are two main types of diabetes. We got type 1, type 2. Yes, you do have gestational diabetes, but we're going to classify it under type 2, even though it can be acute. Type 1, pancreas is no longer producing insulin, right? So there's no insulin to bind with the cell for it to take up glucose. So if you look back, you can find some pretty bad photos back at the turn of the century before we knew the causes of diabetes. People were essentially starving to death. Didn't matter how much they ate, they couldn't get the glucose into the cells, so the cells couldn't get nourished, and so therefore cells were starving to death. So it results in the individual having to supplement the insulin, so either injections, auto-injector, several different methods now of getting insulin into the body. Probably seen it in the news where insulin prices have gone way up. People can't afford their insulin, therefore they could potentially starve to death because their cells can't take up glucose. So it's a life-threatening situation. So type 2, the body, there's a couple different things going on here, and we're seeing this especially as people are getting overweight and obese. See a greater range of this. We're even seeing the type 2 diabetes in juveniles. So the body doesn't produce enough insulin, or the cells have become resistant to insulin. So insulin resistance also happens in gestational diabetes. And your body's still producing it, but because you produce it so much, so often, the cells become resistant to it. And so since the hormone insulin can't bind to the cell, or the cell doesn't respond to it, it doesn't uptake the glucose, and therefore the cell starves. So insulin resistance can be changed through exercise, through diet. Now, there are types of type 2 where the body produces insulin, but just not in sufficient quantities. Hyper versus hypoglycemia. Oh, I forgot to talk about gestational diabetes. Let's go back to that. So, individual gets pregnant. The demands of having an unborn child as it develops, and then if the individual gains a bunch of weight, can cause insulin resistance. And then it's typically acute, not in all situations. Depends on how much weight the person gains, and often will disappear after childbirth. Hyper versus hypoglycemia. These are two sudden illnesses that are pretty common. Hypo is not enough blood sugar. You typically have a gradual onset, so the blood sugar slowly gets low. This can also happen as a result of insulin release. So let's say, and this used to happen to me until I changed my diet, if you eat something that has a high amount of simple sugars, simple carbohydrates, and you eat it, it can cause an insulin response, blood sugar to rise, and then you get an insulin response to meet it. And then your cells uptake all this glucose, all this blood sugar, and then all of a sudden you have a sudden drop in blood sugar. And then you get shaky because your blood sugar drops because of that insulin response. And it was all the result of just flooding your body with all this blood sugar quickly, because it gets absorbed quickly because it's simple sugar. So a good example of that is if I eat enriched grain pasta, so my body processes it really fast, or a candy bar would be another good example. If I eat that before I work out, about 30 minutes of my workout, all of a sudden my blood sugar just plummets. But if I eat whole grain carbohydrates, I don't get that, because it takes my body longer to break down those complex carbohydrates, and I don't get a insulin response because it doesn't flood out into my bloodstream, so I don't get all this blood sugar flooding out into the bloodstream. So I get a smaller insulin response, so the cells use less of it over a longer period of time as well. And I don't get that sudden drop, and I don't become hypoglycemic. Now, hyperglycemia is too much blood sugar. This normally happens because the cells aren't uptaking the blood sugar. They're not using it. So like in insulin resistance, we start having a buildup of blood sugar, because cells just aren't using it. Ketone bodies build up as fats are start to use as a fuel source, and you can get what's called diabetic ketoacidosis because blood sugar gets too high. You get this sweet smell. Like in law enforcement, both of these conditions can cause people to act erratically, and they used to train us to identify it. So there was a episode of Cops where the person, I think, had hyperglycemia because it had that fruity smell. So when the person rolled down their window in the car, the officer thought he smelled like a fruity alcoholic drink, and the person became really combative. Well, they found out, I think they saw a alert bracelet, emergency alert bracelet, or a necklace, one of the two, on the person's neck or wrist or whatever. And then they realized they were having a diabetic emergency. And you can look these up on YouTube where people are fighting because they're hypoglycemic or hyperglycemic and become really aggressive. Hypoglycemia, they just can't make good decisions either because they're just not getting enough blood sugar. Your brain runs off carbohydrate. So care for diabetic emergency. This list of care causes the most controversy. And I'm just following what American Heart says, American Red Cross, what ECSI, all of their standards are the same. So this is if you don't know what they're suffering from, and as long as they're conscious, you give them 15 grams of sugary drink. So we're talking about maybe half a can of soda, right? Quarter can, half can, in between there, right? They drink that down. If it's hypoglycemia, they should recover really quick by getting that sugar into their system. If it's hyperglycemia, 15 grams of sugar is not enough to really cause a bigger issue. Now, obviously, we don't want them to keep drinking sugar, but 15 grams is not enough to really put them over the edge and put them into an even worse situation. So, if the person is conscious and has hyperglycemia, they need insulin. So if there's no change after giving those 15 grams, we need to find some insulin. right? We need to see they probably already know they have a condition. If they're a known diabetic, they should have prescribed insulin. So hypoglycemia, immediate change, they should recover. We can just let them set down, get better. So this could be like a fruit drink, like fruit juice. Fructose gets in the system pretty quick. It's one of the easier, simple sugars for the body to absorb. Hyperglycemia, 15 grams, not going to make that big of a difference, right? According to the literature. I'm referencing this. This is not my opinion. All right, fainting. This is psychogenic shock, right? A person can faint being surprised, bumping their arm, but it is a type of sudden illness. So if somebody bumps their arm and hits their funny bone and it hurts and they pass out because of it, or they pass out because of pain, that's called vasovagal syncope. So the vessels are dilating. The blood pools in the lower extremity. Not enough returns to the heart, therefore not enough gets back to the brain. The person goes horizontal, so the body doesn't have to fight gravity. All right, for your skill, think fast. Stroke. Go through these steps. I put it on the lecture notes, so fill out the lecture notes as you watch the video and go back through the lecture itself. Face, arm, speech, time, whatever you find, you record to or tell 911 if you think they're having a stroke after going through those steps. Videotape that so you'll have it for your template. You can do these templates individually or y'all can remain in your groups. It's up to you. These lecture notes need to be submitted on Canvas. You'll see that right underneath the lecture note, I put a place where you can submit them just like you submit the templates in the face-to-face class.